Ray of Hope, take one.
Here, Matthew, here's your hot dog. It's hot, honey.
I was ready for 3 days sleep after watching.
When I first learned that I had Hodgkin's disease, I was just started my senior year in nursing school. You want some potato salad? And I immediately ran to my nursing books. All the books told me that I had 2 to 5 years to live.
Thank you.
Okay, Alice, we're going to begin your treatment. We'd like you to lie still. It'll only take about a minute.
I think I've been lucky. I could have had something worse, or I could have had Hodgkin's a long time ago where it couldn't be cured.
When I started to practice, Hodgkin's disease was considered invariably fatal.
Tight and the lower mediastinum, but wide.
Fortunately, this is no longer the case. There have been great strides made both in radiation therapy and in the chemotherapeutic treatment of the disease, such that patients with early stage disease have a likelihood of being cured in the 80+% range.
When did you get rid of your mustache?
Oh, shows what visiting only once a year does. Long, long time ago, actually.
Radiation therapy is fortunate in being able to use the latest advances of modern physics in the treatment of patients. This is the best marriage of technology for the good of mankind. Today we're going to discuss the radiation therapy treatment of Hodgkin's disease. I've asked Alice Espanel to join us today so we can talk about her treatment and what has happened both during the treatment and subsequent to it. Alice is from Ecuador, and in 1971, in the spring of 71, she noticed a lump in her left neck. Why don't you tell us what happened?
Okay, I was studying in Switzerland in school, and suddenly I noticed something in my neck. And I didn't want to worry about it, but the teacher said, no, you better go to the doctor. So I went to a doctor in Switzerland, and they didn't know what it was, so they wanted to do a biopsy.
She brought her slides with her. We confirmed the diagnosis that she had Hodgkin's disease.
What we see here is a lymph node in which the architecture is completely destroyed.
Radiation therapy is the prime multidisciplinary approach in the treatment of cancer.
A pattern which is quite classic for Hodgkin's disease.
Dr. Rose, what do you think?
I think that the issue is to try and protect irradiating her pelvis.
Radiation therapy can't be done by the physician alone. It requires the technical expertise of physicists, technicians, trained electronics engineers, a variety of machinists, as well as a dedicated group of physicians having special expertise in radiation therapy.
But I think that the facts that you have pointed out are cogent ones and really give you a good case.
It is quite one thing for a physician or a resident to understand something as it is presented in a medical journal or in a book. It is quite another thing to make a decision about an individual patient.
Therapy is to maintain her reproductive function, to get all the information we can, even at the slight risk of doing a laparotomy.
Yeah, Mike, I think it's reasonable. We chose to try to maintain her reproductive function and take this risk, but you're right. I think it's a risk, and we could have gone either way.
After I got married, one of my first worries was I going to ever be able to give my husband children? Talking with Dr. Levene, he said that there would be no problem.
Who's this?
This is our newest addition, Allison.
Oh my, she is a cutie.
When I had my first baby, I was very concerned whether she would be normal.
Like a little doll.
My husband and I, the first thing we did in the delivery room was count fingers, toes, ears, nose, and if she cried, and she was just fine.
Stephanie.
Hello.
How was this pregnancy? Did you have any problems?
No, worked up until a couple weeks before.
Really? Are you going to go back to work?
Oh, hopefully not for 6 months.
I should think that with 3...
Yeah, well, I'm going to school too, part-time.
It is a malignant disease of the lymph nodes. We don't know what causes it. We fortunately do know how to treat it, however, and we can cure it. That's the real change that's occurred in Hodgkin's disease.
Okay, Alice, now we're going to ask you to lie face down.
We begin with simulating the treatment itself on a diagnostic quality X-ray machine on which we can make films and fluoroscope.
Dr. Malcolm will check the film.
Patients who are going to receive radiation are frankly nervous, awed by the idea of large equipment and very potent treatment. They quickly realize, however, that it is far less intimidating than they thought.
Right now I'm going to be
Most everybody continues their normal activity.
So we will be able to reproduce the setup exactly.
Radiation is quite controllable, probably the most precise instrument we have in medicine. We can pinpoint its activity. It's extremely easy to measure. That's why we know so much about it.
When I first found out about my being sick, I had to be strong for my parents' sake. I really had no one to tell how I was really feeling without making them much more upset than they already were. Special breathing and I felt very lonely. That's a reason why I go and talk to patients, because maybe the patient can relate to me more than they can to their family. The first two, this
So
time I had no
actually
problem.
you've really
Improved.
made real recovery. And I must say that you have three of the most beautiful children I have ever seen. They are so handsome.
Thank you.
Not at all.
Did you have a good talk with Dr. Levene today?
Yeah, he loved Allison. Couldn't believe
Yeah.
we had a...
Third
Every time
already.
I go for a visit, we bring him a new surprise.
Yeah.
We measure the exact contour of the patient so that we are sure about where tissues are using an ultrasound scanner.
Okay, Alice, I'm just going to make a contour tracing of your back.
We must be sure that the dose is correct in all the areas the tumor might be in, and we are helped in these calculations by the use of a computer programmed for a radiation therapy calculation.
Change the scale factors at all, just put them in.
We will mark out the areas of the lung that we would like to block to not have any X-ray beam hit, and we will make individual blocks made of a material much like lead, which will be made to order for Alice and for every patient. And we may change them 2 or 3 times during the course of therapy as the disease changes in an attempt to shield the lungs, the heart, and any other vital structures from unnecessary irradiation.
All right, Alice, I want you to place your hands right at the head, your elbows out, and your chin rests on the sponge. Now I want you to try and hold that position. Very good. Do you have the laser on?
Radiation therapy is an art. We avoid damaging the normal tissues by carefully delineating the beam so that the radiation, when it traverses the normal tissues, it gives as little dose as possible to those areas.
Very good.
Right back.
We're giving her 150 TD.
Alice, why don't you tell us a little bit about what your feelings are toward how you felt during treatment and what it was like?
At the beginning, as you don't know what's going on, you heard that something's going to happen to you, like if your hair is going to fall down, but you don't believe because you never had it before, that you might feel sick or like throwing out or feel a bit tired. And as the time passes, you start feeling those things. Your hair starts to fall apart, fall down.
The hair, being a normal tissue, regrows, whereas the tumor does not.
But that doesn't stop you from doing another things. Like I was here with my mother and we went out shopping, we do things.
You didn't have to be a patient in the hospital for your treatment?
No.
Okay, and when the treatment was over, did these symptoms go away?
Yes, they did. Yes.
Have they ever come back to bother you?
No, never again. Okay. And my hair grew.
Hot dogs.
Doing a good job. The cancer just slowed me down for the first year, but once I was over that, I just carried on as if nothing had happened.
You gonna have a hot dog or a hamburger?
A hamburger.
Hamburger.
Fortunately, in the treatment of Hodgkin's disease using radiation therapy, we can return the patient to their normal pre-treatment way of life.
Matt, aren't you going to eat your hot dogs?
It's tired.
tired.
He's tired?
I believe that the psychology of the patient is very important in the treatment of the disease. And an appropriate attitude to me is a serious attitude, but an optimistic one.
You want to sit in Mommy's lap for a while?
Life for me it's just been beautiful. I have a baby, 2 years old. He's happy and he just looks like me.